For the longest time, we've thought about thumb arthritis as, well, a pretty simple problem of wear and tear. Like the tread on a tire just wearing out after years of use. But what if that's not really the whole story? What if the problem isn't the joint wearing down, but its entire guidance system failing? Well, that changes everything, and we're going to explore exactly how.
So let's look at the base of our thumb. It is an absolute marvel of engineering. It's this unique joint that gives us the dexterity to do delicate things, but also the strength to grip something really tightly. But all that amazing mobility? It comes at a price. And that price is stability. It's a constant battle, and it's managed by this complex web of ligaments. The old belief was simple. When these ligaments fail mechanically, arthritis kicks in. But what if the real answer wasn't in the ligaments themselves, but in the nerves that control them? All right, so here's how we're going to piece this new puzzle together. First, we'll dive into the joint's unique dilemma. Then, we'll look at the classic understanding of its ligaments. And then, this is the good part. We'll uncover the crucial story the nerves are telling us. We're going to talk about this unseen stabilizer called proprioception, look at the hard evidence of how the joint breaks down, and then finally, put it all together into a whole new way of thinking about this condition.
Okay, first things first. Let's look at the joint itself. It's called the trapeziometacarpal joint, or TM joint for short. And it's this joint that gives our thumb that incredible range of motion. But its design creates this fundamental conflict between being able to move freely and staying stable.
Think of it like a saddle on a horse's back. That shape lets you move in all sorts of directions, right? But it's not a deep, secure ball and socket joint like your hip. It's just not. So you've got this trade-off, this morphological compromise. The bones themselves don't offer a ton of stability, so the joint has to rely almost completely on the ligaments and muscles around it to hold it together for everything we do, from typing on a keyboard to turning a stubborn jar lid. And this dependency, right there, that's the key to everything that follows.
For a long time, the story of thumb arthritis was really a story about one specific set of ligaments just giving up. So let's take a look at what everyone used to think.
The focus was always on the ligaments on the palm side of the joint. Anatomists call this the volar side. You can see them right here. And this one in particular, the anterior oblique ligament, or AOL, was seen as the absolute star player. The theory was super simple. This ligament gets worn out, the joint gets unstable, and bam, arthritis sets in. It was seen as the first domino to fall. And believe me, this wasn't just some fringe idea. This was textbook stuff. This quote right here really shows you just how central the AOL was to the whole theory. It was the main culprit, the single mechanical failure that kicked off this whole degenerative mess. This was the accepted story. But a new line of research, one that wasn't looking at mechanics, but at nerves, started to suggest that the real story was happening somewhere else entirely. And this is where things get really fascinating. This is where the whole story gets turned on its head. Researchers, including incredible teams led by doctors like Ladd, Haggard, and Weiss, decided to look closer. They weren't just looking at the structure of the ligaments, they were looking at their neuroanatomy. And what they found? It changed everything. And this right here, this was the first big clue. During these incredibly detailed dissections, they started noticing this dense web of nerve branches, which you can see highlighted, all feeding into the ligaments on the back of the thumb, on the dorsal side. Now this was really unexpected. Everybody thought the important mechanical parts were on the palm side, so why on earth was the back side so packed with nerves? And when they actually graded the nerve density, wow. The difference was staggering. The three main dorsal ligaments were absolutely packed with nerve endings. And the volar ligaments, including that supposedly critical AOL, they had very few nerves. And in the case of the AOL, almost none at all. So think about that. The ligament everyone thought was the main mechanical stabilizer was neurologically silent, while the ligaments on the other side were just buzzing with activity. It raised a huge question. What were all those nerves doing?
The answer to that question lies in a concept you might have heard of but probably never connected to arthritis: proprioception. It's basically the secret sauce that keeps our joints stable.
Proprioception is often called our sixth sense. It's the reason you can close your eyes and still touch your nose. It's this constant, non-stop stream of information coming from tiny sensors in your ligaments and muscles, telling your brain exactly where your body parts are in space. And that information lets your muscles make tiny, instantaneous adjustments to keep you stable. It's a dynamic, intelligent guidance system, not just a bunch of passive ropes.
And when you know it, when researchers put those dorsal ligaments under a microscope, they found the sensors. This little guy here is a Ruffini ending. You can think of these as the joint's position sensors. They are constantly sending updates to the brain about where the joint is and how much tension it's under. That's what allows for that fine-tuned muscle control you need to keep things from wobbling around.
And they also found these Pacinian corpuscles. So if the Ruffini endings are the position sensors, these are the motion detectors. They fire off signals when the joint suddenly speeds up or slows down, kind of like a security alarm for sudden movements. So you see, the dorsal ligaments aren't just passive restraints at all. They're a super sophisticated sensory organ, actively monitoring the joint and feeding that intel back to the brain for dynamic stabilization.
Okay, so we've got this new theory, right? Thumb arthritis might actually be caused by a failure of this sensory system. But does the physical evidence, what we actually see in patients, match the theory? Let's take a look at how the joint actually breaks down.
Using some really advanced 3D CT imaging, researchers were able to track the growth of osteophytes, bone spurs, in people with early thumb arthritis. And what they found was really specific. On the metacarpal bone, the one coming from your wrist, the bone spurs consistently grew on the palm side and the back side. You can see these peaks here on the plot. That's exactly where the extra bone is forming.
Now here's the real kicker. On the other bone, the trapezium, the bone spurs grew in a totally different pattern. They grew on the sides of the joint, one side pointing toward your index finger, the other toward your pinky. They weren't growing in the places where they would grind against the spurs on the other bone. So here's the absolute crucial point. The bone spurs are non-opposing. They don't line up. And that pattern just doesn't fit with a simple story of cartilage wearing away from mechanical grinding. It just doesn't work. Instead, it points to a much more complex pattern of instability, these tiny little micro-movements and forces pulling on the edges of the bone in a very specific, very predictable way. It's totally consistent with a failure of dynamic neuromuscular control.
Okay, time to put all of these pieces together. We've got a highly unstable joint, we've got ligaments on the backside that act as a sensory organ, and we have this strange, non-opposing pattern of degeneration. This all leads us to a completely new model for thumb osteoarthritis. And we really have to start right here. This disease is overwhelmingly common in women, especially after menopause. I mean, the numbers are huge. This points so strongly to hormones playing a role. We know that after menopause, changes in hormones like relaxin can make ligaments more lax, more stretchy all over the body. And in a joint that's already unstable like the thumb, that extra looseness puts an even bigger strain on that neural guidance system, potentially overloading it. So here it is, the new paradigm. It starts with hormones, which can lead to looser ligaments. This increased laxity then overloads the sensory system in those dorsal ligaments. Over time, that system just can't provide the clear, crisp feedback the brain needs for precise muscle control. And this failure of proprioception leads to dynamic instability. The joint just isn't being controlled properly from moment to moment. The result of that failed control isn't random wear and tear. It's that very specific, non-opposing pattern of bone spurs that we see in patients. So thumb arthritis, it's a disease of failed neuromuscular control.
And this brings us to the final and maybe the most important question of all. If the root cause isn't just worn-out cartilage, but a failure in the joint's own sensory and control system, doesn't that completely change how we should think about treating it? It suggests that maybe, just maybe, we should be focusing on therapies that can actually retrain this proprioceptive system to improve neuromuscular control long before we even think about surgically replacing the joint. It's a fundamental shift, moving from seeing this as a simple mechanical problem to seeing it for what it might really be, a neurological one.